better tighten up.
What's up, guys? John here, Titan Lifestyle with Big Dru.
Titan Lifestyle, Big Dru here with John at the Titan office. Got a lot of good stuff going on there. A lot of craziness out there with everything that's going on. But first things first. You guys have been asking my lift party. We got a date set.
Yes.
I'll give you the date, but I'm not going to give you the location. The date is April 4th, which is a Saturday. You guys check your DMs. I'll be sending out my invitations. I've already started sending them out.
Yep.
Please don't forward the picture that I send you. This is an invite-only party.
Yep.
It's kind of like a VIP thing. If you guys get the invitation, you're welcome to invite others. Just send me their DM me their information, and I'll send them an invite as well. But it's April 4th, the Big Dru lift party. We're going to have pro bodybuilders. We're going to have power lifters. We're going to have some pro CrossFitters. And pretty much just a good vibes only event. People keep asking me, what is the lift party? It's basically just a big workout party. Yeah. Everybody likes to go to the expos to walk around and show off their bodies, but there isn't really a workout expo. So what I try to do is have a lift party, which is like a big workout expo to get everybody together and just work out. The vibe's usually crazy. We're going to have video. Yeah. We're going to have free Titan therapies. If you guys want to check out any of the therapies that we've always talked about, come check them out. Just got to fill out the paperwork and take care of you. But it's going to be great. April 4th. Check your DMs. Big Dru lift party.
Yeah, man. Big Dru lift party. I'm looking forward to it. April 5th. 4th, excuse me, April 4th. Just in case everything is good to go, we should be good to go. We're going to have a lot of different people there, like-minded people. I'm really excited. We've been talking about this forever, so thank God we're putting it to fruition and bringing it forward. So if you guys get that personal invite, keep it to yourselves. But it's going to be one heck of an event. We're going to have a lot of different things out there for you guys. So I'm really excited.
We're going to have some squat to drop for the ladies. We're going to have a squat off. Who can squat the longest. We'll have some bench press competitions too. Maybe you guys can win some free shirts or free samples of therapies. A lot of good stuff going on. The music's going to be crazy. The vibe's going to be crazy.
Oh, yeah.
It's going to be a good time.
What's up, Rocco? How you guys all doing? Joining us on Titan Lifestyle Friday with Big Dru. I appreciate it. Big lift party, Big Dru lift party coming shortly. So look out for those invites, all right? Yeah. Next thing, Hercules and ECA for pre-workout.
Perfect. It's the perfect combination for pre-workout. Here at Titan, we don't technically have a pre-workout. We don't do the bullshit powders. We do actual quality stuff.
Yep.
People keep asking me, what does Titan have for pre-workout? That's what I use for my pre-workout. Again, it's not known as a pre-workout, but the ECA, which is ephedrine HCl, pharmacy-approved ephedrine HCl, aspirin and caffeine, that combination will get the veins going, get the energy going. No jitters, no dizziness. And the Hercules, pump all day long. So you get a combination of the pump and the energy. And I mean, it's just crazy. It lasts a long time too. This Hercules potion lasts longer than the powders you guys use.
Oh yeah.
It's going IM, so it doesn't have to go through your stomach.
Right.
So you feel a lot better. Take that with the ECA, and you'll work out like crazy. You'll sweat like crazy too, which is also good about working out. Yep. You want to keep your body thermogenic. You want to be hot. That's why they say warm up. That's why they say working up a sweat.
That's right.
You guys that have problems sweating, the ECA will actually help you sweat. When you're sweating, your body's trying to fight to cool it off, which means you're burning calories, so it's crazy.
That's right. So that's what he's talking about. So ECA Stack Plus. So ECA's been around, ephedrine, caffeine, aspirin, right? They were over the counter for a while. They got banned, and the only way you can get is prescription. Ephedrine HCl. So we've actually added a little bit better things into this with adding the chromium and the B12 to actually help boost the metabolism naturally, right? Processing fats to the livers quicker. So at that point, you guys can get leaner, you guys can get more energy, better concentration, focus out of it. And what it's doing is raising the core temperature, like Dru said. That's why you're sweating more, you're burning fat, right? So that's the best thing as far as stimulant-wise, concentration-wise as you can get. Next thing, Hercules potion. So he's talking about the pump. L-arginine, L-citrulline, precursor to nitric oxide. This is going to vasodilate the veins, more blood flow, better pump, right? And this is going to overall affect the body in a lot of different ways. Bringing more nutrient, bringing more oxygen to the muscles as well. Plus, L-ornithine's in there. So ornithine, an anti-fatigue amino acid. This is really key because when you add it on to these different ones, these different amino acids like arginine, L-citrulline, not only will you get the pump, right, that lasts for hours, but you'll get the anti-fatigue amino acids, which means you can do more workouts, more strenuous activity. So whether you're hiking, running, training in the gym, whatever you're doing physically, you can do more of, which will get you better results, right? Now, don't forget about glutamine. Glutamine's in every kind of different powder or supplement you see out there. Yeah. This is injectable. Recovery is key. I talked to somebody the other day that said, man, it takes me like 4 or 5 days to recover. What do you guys have for recovery?
Yeah.
So Hercules Potion goes right along with it. Yeah. The only thing is you don't feel the immediate effect like you do with the arginine citrulline with that pump, but you will recover quicker. Yeah. NAC is good for liver functions. Taurine is good for brain function. L-carnitine is good for blood flow and weight loss. Plus, you got proline. It's a collagen-based amino acid. What this is going to do is lubricate the joint areas, right? So you guys are repairing or not having this problem with the shoulders or the knees as much as you usually did. So these are just some different things that we're added into. And when you combine them, like he said, you're going to get the pump, you're going to be able to work out longer, plus you get the stimulant factor from the ECA Stack Plus, which will help you out with weight loss and energy. And these are great things to add to your routine of any strenuous activity or anything that you're really doing. Even day to day, ECA Stack Plus, I take one in the morning, no coffee, no energy drinks. I'm ready to go and train maybe at 6, 7 o'clock at night or out through the day. Plus I have energy to go throughout the day, and I'm really just rocking and rolling. So a lot of people do that. Those are really, really good ones to add. I think they're really the top therapies as far as amino acids and all that. So really, really good.
And again, guys, what he said, you could take it during strenuous activity or for if you have a long event or something you have to do. It doesn't have to be specifically before you work out. Right. I have a client that actually works construction here in Florida. It's hot all the time. Yep. He's actually taking the ECA. He's actually leaning out pretty well just from sweating all day, moving around. Yep. So he's doing construction. He's in the heat. He's sweating. He's taking his ECA. He's hydrating. He's eating. He's losing weight just from doing his daily job, because being in that heat, and then on top of that with the ephedrine and the caffeine and aspirin, he's actually leaning out, and he hasn't been able to get to the gym because he works so many hours. Yep. So just that alone is leaning him out. Now the only thing he changed was adding the ECA. He's still doing the same work he's been doing for almost 7 years now. He's still in the same environment he's been in for his whole life. He's from Tampa. So, I mean, just adding that in there will help as well. You don't have to work out. If you guys have injuries, you have a hard time losing weight, or you have joint problems or knee problems, you can't do the physical activity, combined with a great diet, the ECA will definitely lean you out. Make you feel good, give you energy too. You got kids, take an ECA, because those kids...
And if you're going for a calorie deficit type thing, these are really good. And like he said, I was supposed to go to Disney next week, but it got shut down. We'll talk about that later. But I usually take a shot at Hercules Potion before I do that, because I'm walking around the park all day long. Yeah. And it's strenuous, it gets fatiguing on you too as well. So at that point, I usually take it then. So it's good for a lot of different ways or a lot of different things that you guys want to do out there. Photo shoots. Great. Pumps. Yeah. So I was in here for Anastasia Ryder's new Team Titan member. She was talking about, I can't wait to use Hercules Potion, especially for photo shoots and stuff like that, so I can pump up beforehand and have that effect full through the shoot and not have to worry about things.
And if you guys are lean enough, ladies, if you're lean enough, you put it in your glutes and catch a pump in your glutes. Again, it's gonna cause a pump to your whole body. But the specific area you put, you're gonna feel it a lot more. If you put it in your biceps, you feel your biceps. So, ladies, if you're lean enough, where your glutes are lean and they're not too far away from the skin, there's not that much fat in between your glute muscle and the skin. If you're using your glutes, it's gonna swell them out a little bit too.
Absolutely.
If you have a photo shoot, you can put a couple mLs in your glutes, swell them out, and it's gonna stay too. It's not just gonna get a pump and go away. A lot of powder stuff that you take, the pump goes away because it's going in your system. What happens? You take powder stuff for a pump, you drink a gallon of water because it's so hot outside, you're literally urinating, you're excreting all that stuff right into the toilet. You're not going to have that problem with this stuff. It's going to go right into the muzzle, and it's going to stay there for a while. So if you guys want to get a pump, you got a girl coming over, you want to catch a pump, take some Hercules, do some push-ups. You're going to the beach, want to catch a pump, walk around, take some Hercules. Spring breakers. It's spring break right now. You guys are coming down here from up in the cold. Everyone down here is pretty much... showing off their body all day long. Grab some Hercules. You'll be pumped for the whole spring break. The pictures will be crazy.
Plus, it'll help sexual function too. If you guys want to use their blood flow down to the genitalia area, you're ready to rock and roll, just like Hercules was. And absorbency. So let's talk about transportation rate. Fastest transportation rate, unless it's IV, and highest absorbency. It's not getting broken down through the gastro tract. Me and Drew were talking about that earlier, about things getting broken down when you have to swallow it orally and what the percentages of absorbency. Talking about maybe 10, maybe 20, and I'm being very generous on a powder absorbency. When you're going through IM, you're talking about 70, 80%. IV, even higher. So at that point, this is a very, very easy way for you guys to do it. You guys can do it at home. in the privacy of your office, wherever you're at, you can take it with you, your hotel room, whatever it is, and be ready to rock and roll a couple minutes later. So it's really good. So Hercules Potion, ECA, definitely recommend.
And real quick, he said IM. We're going to also do it IV. We have the IV drip therapy bags now. Yeah. So if you guys want to come in and get your bag, we can actually put the Hercules in the bag and have the Hercules go IM. Actually intravenous. I tried it the other day, and it was, I definitely felt it.
Oh, yeah.
So it was the first time I tried. I didn't know you could do intravenous Hercules, but I was getting a hydration bag, like you see the yellow bags we have. Come down and grab one. He actually put that in there, so you can get it that way too. So if you come down and get a bag, tell them to throw that Hercules in there too.
We just add every component in singly that's in the Hercules Potion. That's how we do it. Where the Hercules Potion is blended, we can't actually put the Hercules in there, but we can put every ingredient to make a Hercules Potion in the bag. So that's how it goes.
So it's individual. So if you guys check my store, you can see the big box with all the different colors of the products. Each one of those is the stuff that we have in the Hercules. So it's technically what he says. It's not going to be the actual Hercules Potion, but we'll just take each individual ingredient and put it in there for you.
That's right, man.
Check the video to see.
Ready to rock and roll there. So that's awesome. The IVs have been a killer thing, especially with what's going on out there. And like I said, we'll talk about that in a minute. So estrogen effects, side effects.
A lot of guys. A lot of guys.
Like tomatoes.
Pretty much, if you have elevated testosterone, your estrogen is going to go up. A lot of people that do their own testosterone therapies, they're not checking their estrogen, they're not getting their blood work done, they're basically self-diagnosing. So what happens is if they're taking testosterone, or they're taking, even if a bad diet can raise your estrogen as well.
That's true.
So if you have a bad diet, or if your testosterone levels are elevated, you need to take some Anastrozole. You need to take something that's actually going to keep your estrogen regulated. You don't want to wait until you have puffy nipples. You don't want to wait until you have water retention, this and that. You want to control it before it happens. So Anastrozole, that's what I use. Anastrozole. That's pretty much the best estrogen control that I use. I think it's the best one they have out there. But you definitely want to regulate that. You definitely want to make sure it's estrogen too. If you guys are taking other stuff, and you have sensitivity in your nipples or your mood swings or whatever, that might be your prolactin levels. So don't just self-diagnose. I know guys that's popping Anastrozole all day long because they're thinking it's estrogen, but it's prolactin. Prolactin's a whole other thing where you might need cabergoline or something like that. But just make sure you're controlling your estrogen, guys. It's not just about a lot of guys that take testosterone. They're worried about puffy nipples. It's not just puffy nipples. You guys can have no sensitivity in your nipples and still have elevated estrogen.
Oh, big time.
And you're gonna have love handles, or you might hold water, or it might just be your mood. Your body might show no signs of estrogen, but it could be elevated, and then your mood's all messed up. So definitely, estrogen controls a lot, guys. It's not just about puffy nipples and water and fat. Estrogen is it can literally make you crazy one way or the other if it gets too high or too low.
Absolutely. You can have mood swings, that snappy, you're just irritable all the time. You don't know. Sensitivity as far as if you watch a sensitive movie or something that's sad, you're crying. You don't know why you're crying afterwards.
It's military reunions.
So
you guys are watching the military reunion where the guy walks in the gym to surprise his son. If you get a little bit weird, estrogen's
gynecomastia is another big one. So estrogen, what it does is it helps grow tissue, right? So you don't want to be too low on estrogen, you don't want to be too high on estrogen, because if you're too low on estrogen, you can't grow either. But if you're too high, this is where gynecomastia comes in, the man boobs, right? You don't want man boobs, especially if you're taking off your shirt. So at that point, you got to make sure that your estrogen is regulated. So you want to make sure that it's balanced. The only true way to do this is by blood testing. Now, I see a lot of different people out there too, and I see on these forums and stuff like that where they're talking about ratios. So these guys have elevated testosterone 2,000, and they think their ratio of estrogen is fine at 100. Now listen, it should still be within range. The range is there for a reason. Even if you have crazy levels of testosterone, don't ratio it out. I mean, I'm telling you, you'll get a way better effect and a lot better result if that is in range. I'm telling you, I've seen thousands of blood tests and thousands of patients come through here, do it from doing it themselves to doing it through us, and we make sure that they are dialed in, basically. And when they're dialed in, they get a lot better result, they feel a lot better, and things are just coming together a lot easier for them.
The range is everything. The range is everything. Because if you're self-diagnosing, you're just taking estrogen blockers, whether it's something extremely strong, like a suicide one, like Letrozole, which is Femara or something
Yep.
like that. If you guys are taking that stuff and you're just taking because you're trying to lower your body fat, lower your water retention, or lower the puffiness and the gyno.
Yeah.
If you're just taking, now you have another issue. Now you have no sex drive. Now you have ED. You have libido issues. You have mood swings. So just like John said, keep it in that range is perfect.
Yep.
Whether your testosterone's in that range, everything has to be in that range.
Yes.
Too high or too low is never a good thing.
Absolutely.
Never a good thing.
Plus, like he was saying, if you take too much of these estrogen blockers, aromatase inhibitors, that's what AI stands for, you're going to have drier joints. You're going to feel a lot worse. And it can actually cause a lot of harm, or you're going to be very uncomfortable in some of your lifts and the way that you feel afterwards. You're going to be like, man, my joints are really hurting on this. I don't know what's going on. An injury, exactly.
You have no lubrication and connective tissue.
None.
Guys, you're lifting so heavy, that injury is going to pop.
Of course. So aromatase inhibitors, and like he was talking about, there's different aromatase inhibitors out there. Anastrozole is the main aromatase inhibitor used, right? And then you have letrozole, which is a suicide aromatase inhibitor. That means it kills the estrogen in your body completely at that point. Now, these medications were originally developed for women, post and pre breast cancer patients. And the reason was because we know that high levels of estrogen can cause cancer or cancer growth or fuel cancer growth. And that's one of the main things. The first one that came out, the originator, was Novaldex, tamoxifen, right? And that is good for only one thing. It kills the breast receptors, and that's it. The estrogen breast receptors, that's what it goes after and controls. So that's why anastrozole was made afterwards, and that's why it's primarily used with males, because it controls the E2 in there. So the water retention, all the other different things, not just the breast receptors. So at that point, that's why anastrozole is commonly used. Letrozole and aromacin's another one that just came out, and that one's been pretty good. And it has studies behind it of also raising free testosterone levels along with it. But listen, too much of that can lower your estrogen to levels that you don't want to be at. Some people might need it, but there's very few cases that I've ever seen come through here that actually do. So it just all depends on you. Everybody's different to an effect. Some things are made for the masses per se, but some people might need to be dialed in these different medications. And that's where you need to have a real medical professional looking after you guys, dialing these things in, okay? All right, so let's get into glutathione. I had a question about glutathione. So how do you take glutathione? Orally. Daily is what I would say right now, especially. Orally, it's not going to absorb, okay? So they have studies and stuff like that. Oral is no good. Injectable, IM, right? You don't want to inject it sub-Q. You want to inject it IM with a little insulin needle. You can do that. You can do that with us. It's very simple, very easy. You get some new patient paperwork, fill it out. We get you on the schedule with a medical provider. Boom, bang, bang. Especially right now, we can do telemedicine because of the emergency that's going on right now. You guys can get it to your doorstep in a couple days. You guys can inject this. It's a super antioxidant. It's going to help tremendously. If you're sick, you're getting sick, you want to be preventative, free radicals in the body, inflammation in the body. So if you have arthritis or anything like that, this is going to help that too as well.
Is there anybody that can't take glutathione? Is there an age limit, too young, too old?
Nope.
Is there anybody that can't take it?
No, we service 21, and up as far as that goes for glutathione. I was actually with the kidney specialist yesterday with my dad because he's in stage 4 kidney failure, right? And it's because of diabetic fibrosis in the kidneys, and it's all damaged, and basically there's no coming back with kidneys. And even if you have 2 of them, they die and that's it. So at that point, glutathione was one that is going to help slow down the kidney disease so we can hopefully not have them go on dialysis, because that's a big thing. When you have to go in there, dialysis is a whole big thing. 16 gauge, 18 gauge needles go in your arm every week, and then basically recycling your blood, and filtration in the kidneys and stuff like that. So you guys don't want that. But glutathione, especially right now with this coronavirus outbreak, has been key. And as we're talking about that, washing your hands is being key. Staying around or staying away from people that are sick, coughing, sneezing is key. And just making sure that you're taking the proper precautions in doing this. Pumping your cells up with antioxidants. Vitamin C injectable, we have it. Glutathione injectable, we have it. Nectar of the Gods, it has glutathione in it at 60 milligrams, but also has NAC in it, which is a precursor to glutathione. And also has arginine, it has lysine in it, which are great for the immune system and blood flow that will help out as well. Plus, thymosin alpha-1. So that's a huge one, guys. This is an immune system modulator. That means it's going to build your immune system, be stronger. It has T cells in it, helper cells and killer cells that go after these different cells that might be with virus-related, cancer-related, and it actually kills these things off and actually brings back the cells to be healthier. So it's really these things you should be looking at, okay? And as we're talking about this, MLB, NHL,
everything's canceled.
Everything's canceled. Suspended seasons. I mean, I was talking to Drew and Art with this earlier. I'm 39. I've never ever seen a suspended season unless it was a strike. I remember baseball did a strike.
Basketball.
They might do a strike and stuff like that. But for these reasons alone, like even in March Madness,
I was excited it was going to be right here.
Dude, I mean,
it's going to be in Tampa.
The Valsbury Championships, I was supposed to have tickets to that to go check it out.
Boston Marathon.
I mean, these things are shut down. Disney World, shut down. You know, how many billions of dollars do you think in revenue that these people are losing? And you think they're doing it for just some, we're just going to lose this money. No way, dude. No way. So it might be over crazed, as far as the coronavirus craziness, that's what we're calling it. But you never know. So just keep yourself safe. Do the right thing. Pump yourself full of antioxidants. Make sure you clean your hands properly, 20 seconds. I showed my son the exact same way. I'm like, listen, this is how you got to do it. Not just, I'm done. No, you got to make sure that you're washing properly.
I'm using that Blue Dawn.
Yeah.
I'm a Blue Dawn guy. Blue Dawn is like, they have all these new hand soaps and Palmolive hand renewal, this and that. I'm just such an old school Blue Dawn, so now whenever I watch, it looks like suds all over them, just slamming that Blue. Nothing like that Blue Dawn.
High concentration. You know, if it can get oil off of those animals that come off, from the oil spills, it's going to be able to get everything off your hands too.
And not only that too, guys, make sure you're using an antibacterial soap.
Oh yes.
Don't go to the dollar store and buy the soap that smells good. Just because it smells good or because it makes your hands feel soft. At this point, who cares how it makes your hands feel? And who cares what it smells like? It's about being healthy. It's about being clean. It's about not getting sick. So make sure it is antibacterial soap.
Absolutely.
And real quick with the glutathione, guys, if you guys get glutathione, make sure you take it daily. Don't just take it, wait a couple days, take it. Don't just wait a couple weeks. Don't wait till you get sick. Take it every day. That way you're not going to have a problem,
What's up, guys? Thank you for joining us. Titan Lifestyle with Big Dru every Friday at 2 p.m. What's up, Matt? If you guys are just joining in, thank you. If a guy has gynecomastia, can you use testosterone? Yes, you can use testosterone if you have gynecomastia. That's not really a health issue. That's more of an aesthetic issue at that point. And you can take testosterone. Just make sure you're taking a proper estrogen blocker. The really only way to get rid of gynecomastia is through surgery. I know there was some different medications out there supposed to lower lumps and all that I've seen out there. I haven't seen too many patients get away with using that and getting away fully of gynecomastia. So that's what you got to watch out for. Just make sure you guys are knowing and you guys are educated in what's really going to help. Glutathione can be taken year-round. There's no health risk for this. Your body naturally produces glutathione. It's produced in the liver. It depletes fast. Let me tell you why it depletes fast. Free radicals. Now, free radicals are everywhere. From the pollution in the air we're breathing in, putting stress on the body. It's a natural thing. And free radicals are good to a certain point, but if free radicals go unchecked and there's too many free radicals and not enough antioxidants in the body, it can cause problems to DNA, protein, all different types of things in your body, and these can lead to bigger health issues. So glutathione is key, and you can actually blood test for glutathione. We do the blood test too as well, but it's not a bad thing to take exogenous or more glutathione than you may need. So every day might be a good thing. Through the IV, you can get 200, 400, 600. I wouldn't really recommend going over 600 milligrams of glutathione IM, okay? If you take too much glutathione, so if you take like 1,000 milligrams, 2,000 milligrams a day, this can cause skin whitening. And that's the one thing that you want to stay away from. So that's the real risk, I would say, if there's any risk out there, is doing too high of an amount. But if you're doing an IM, like with an insulin needle, 200 milligrams per day, you're fine. You're going to give your body what it needs, and it's actually going to help your body out a lot and the way you feel, plus prevent you from getting sick. Now, these are from kids coming home sick, right? Other people coming around you, if you're in a service industry job, or right now with the coronavirus out there, you want to make sure that you're pumping your body full of super antioxidants. And like we said, it might
fluid too.
Oh, fluid for sure. Hydrate, rest. You want to make sure you're getting these things.
Be careful in the gyms. Gyms are one of the most germ-infected places. Man. Everyone's touching, everyone's sweating, especially saunas, guys. If you go in a sauna, I wouldn't even recommend going into a sauna right now with all that sickness going on. There's no ventilation in there. Everybody's sweating. People are they're bare feet and sweating all over everything. It's not really. If you have to, I'm not telling you what to do, but I wouldn't recommend going to a sauna right now. Or if it's a private one, that's fine. But is it really worth it to go in there to sweat for a little bit and get sick for like 2-3 weeks?
It's not, guys. Honestly, get in your shower, turn it on as hot as possible.
Exactly, that's what I do. Yeah,
dude, put the head down all the way to the ground so you don't burn your skull on yourself.
Keep the fan off.
That's
if you have a a heat lamp in the shower, put the heat lamp on the shower, and turn the fan off.
And I showed you guys those vapor tablets. Put them right in the shower. You can still order them from Amazon. Put them in your shower. You get the vapors breathing in, open you up. If you have congestion, and you can sweat in there with your shower, you have a steam shower right in your own house. You know, use your house for what you can. I was showing everybody a workout. Like I got like a Hoy 7 like gym workout in my house. So I haven't been able to go to the gym over here. I just haven't wanted to. So at that point, I've been going there and just working out at my house. And if you guys have to do that for 30 days, just to get over this thing, make sure you guys don't get infected or affect somebody else. Because really, that's the thing. Like, you might have a great immune system. We might be younger. We work out. We got a great, healthy lifestyle. But my dad's retired. He's not that good, so he could be compromised. So if I bring him home, and let's say I'm asymptomatic, because a lot of people, they said little kids, good people with strong immune systems might be asymptomatic. That means you might not feel the symptoms, but you're carrying the coronavirus. Now you take it home to somebody that might not be as strong of an immune system as you have, and you might get them infected, and that could cause possibly some health issues or terminal issues with that family member or somebody that you're around. So just make sure you guys are being precautious about yourself and about people that are around you, your loved ones, or the people that are in your household, because that's going to be the biggest thing.
And don't, guys, I know I see a lot of stuff going on. People joke around the viruses and that. I mean, if you're by yourself with your friends, whatever, joke, whatever. But don't go into businesses and touch stuff purposely as a joke. Don't cough in a large area to see people's reactions. I see videos now going on where they'll literally walk into a crowded area and someone will fake sneeze to get the reaction. Come on now, really? Come on, you don't need to be like this is a serious time where people are really getting sick. People are really affected by this. If you want to get a reaction, do it another way besides this coronavirus, because I mean it is a serious issue. The economics take a huge hit from it. I was kind of joking around it at first, like I don't care about the coronavirus, it's just the flu. Even if I do feel that way, it's affecting a lot of people. So you don't want to go joking and coughing and this and that as a a joke or whatever. You
don't know whose family member or who has been affected by this or who has died. Okay, even a good friend of mine, Michael Pittman, right? So if you guys know Tampa Bay Bucks, right? He was a running back here. Championship Super Bowl player, part of Team Titan before. Jack, he's out in California. One of his family members got contracted the coronavirus, went into a coma. So right now, that's what he's dealing with, and he's really serious about not joking around about this. If people are dying or they're getting hurt, it's not something to joke about. I don't care what you guys think about it, where your opinion's at on it. Everybody can have their own opinion. Just stay safe and make sure you guys are taking other people's feelings, into consideration, because this might affect them.
Yeah, look at look what happened with the NBA guy. He was joking around. He was joking around about it. Started touching stuff. Next thing you know, he has it. Now the NBA is canceled. So I mean, you never know what's going to happen. You never know who's watching. You never know who's going to be affected by it. I mean, you wouldn't joke around about cancer or AIDS or something like that because you don't know who has it. So don't joke around about the coronavirus, like you said, because people are being affected by it.
So, Mr. JT, personnel, yes, you can take any one of these compounds by themselves. So glutathione, you can take injectable vitamin C, nectar of the gods. These things you can take by themselves, right? So glutathione will probably be the most effective for you guys. The vitamin C might be another thing, right? You guys can take these separately with a little insulin needle. It's not a big 23 gauge testosterone needle, 1 inch. It's a little half inch, right? 30 gauge needle. It's an insulin needle, diabetic needle. P30, 3FD. You can take any of these, military personnel especially. I want to make sure you guys are safe out there. Glutathione, any of these injectables are all natural. There's nothing that's going to, get you thrown out of the service or anything like that. It's actually going to help you guys. There's nothing that's banned out there, so athletes can take this too as well. So this is just open for you guys.
So NCAA,
I've got professional football players, basketball players, baseball players, hockey players. You name it, pretty much everybody loves glutathione, and that's just not because of this too. It's just, in regular days before the coronavirus and all this, it just boosts their immune system and helped them in different ways with inflammation and stuff like that. So that's really where they come into play.
If you guys check the NCAA banned substance list, you could Google it, pull it up online. The list changes a lot every year, sometimes twice a year because of those. Check the banned substance list, and you can see that everything's legit on there.
What's up, Antonio? How you doing, man? Yeah, so we heard the air show got canceled here in MacDill, which is, I don't think that's ever got canceled either. So I mean, there's a lot of different things. These are first times for events, and obviously, either it's just a big scare or something very serious out there where it can affect us. So they don't want that to happen. So at that point, just take the precautions that you need to. And I think people are getting a little out of control. So all the toilet paper is gone. I even went on Amazon and tried it.
For what?
I mean, you can still get water, but you can't get toilet paper, right? I mean, water's more essential than toilet paper is. So at that point, listen, get the real necessities that you guys need. Yeah. And don't try to gouge people either. I taught people how to make hand sanitizer on Titan Talk. Real simple, real easy. 90% alcohol, right? 2/3 cups, 1/3 cup of aloe vera. Put it into a sterile bottle that's been cleaned. Swish it around. You got antibacterial hand sanitizer. You guys are set. You guys don't have to go out and get it or worry about buying it for $20 or $30. I bought N95 masks yesterday. I bought 10 of them for $200 because I couldn't even buy them from my medical suppliers. And I'm a medical center that I could buy any medical supplies in the country and can't even get a hold of them because they're sold out. It's nuts, guys. And my doctors and physicians might need these for when we do treat cases, or people might need the hydration, like the IV bags. If you guys need these IV bags or you guys need therapies, we're going to be able to offer this if everything gets locked down. Don't worry, Titan Medical Center is going to be able to service you guys one way or another, I promise. So it's been crazy, man. It's going to get nuts.
Real quick with the college sports too. What I want to know is, say if I'm an athlete and I could possibly be drafted this year,
right?
And that I mean,
oh man,
what's going to happen if I'm a football player and I want to go to the draft, or this is my year to step on the field or in the basketball court or whatever, hockey, tennis, whatever.
Yeah.
And now they cancel the year. How is that going to? Are they going to give a red shirt? They're going to have another year of eligibility. If you're a senior, if this is your last year, like, is it going to affect you going to play professionally, or if you're in high school? Is it going to affect you going to college? Like, are they going to? Because you can't get years back.
No, you can't.
So it's kind of like, I mean, if you're a professional athlete, you're already at the highest level.
Right.
You could they could postpone it, or they could suspend it. You come back. But if you're in college every year is huge.
Right.
Depending on, like, I know football players, they get injured their junior year in college.
Yeah.
And now they're just done. They're going to be drafted. Yeah, so they don't have time, or senior, they don't have time to come back.
Right.
You don't really have time to come back. So I'm interested to see if anybody knows out there, hit me up. Like, what's going to happen with these college athletes in terms of, are they going to get another year of eligibility? Or because if I was a basketball player this year, they canceled March Madness.
Yep.
So I've been busting my ass all year to get to the Final Four. What if I'm a senior? This might be my last year.
Yeah.
They cancel the season. Now I can go to school. I graduate, but now it's like,
yeah,
I have nothing to look back to. You can't go back.
I mean, it's a serious question. It's going to affect a lot of different things. Yeah. And obviously our economy and everything's going to be affected right now with everything shutting down, everything going crazy right now. So at that point, listen, just prepare the most. And that does suck for those players out there. And let's talk about even the professional players. The NBA, all those players are guaranteed their money. I don't think baseball and NHL cover that. So unless they play some games, some of the players, not all their money is guaranteed either. That's another thing. It could affect the professional players in some light. NBA, they're all good. Even with Geiger, when he got hurt his last year, he got us $30 million no matter what. Yeah. So the basketball players, I think, are set. Now some of these other players, who knows? So at that point, it could affect them too as well. So it's really, really crazy.
And with Harvard, I know with Harvard, they just canceled. Everybody had to leave. They had to leave campus.
Yep.
So a lot of the people, a lot of people at Harvard, they have decent money.
Harvard, Stanford, all the major colleges are.
But like if you're a lot of those kids are homeless. A lot of those kids don't have the money to be able to go home. They're living off of just scholarship. So there's literally, they're opening up homeless shelters, and they're also giving college kids free storage units.
Wow.
A lot of the places up north or anywhere, they're giving college places free because these kids are getting kicked off campus and they have nowhere to go.
Yeah.
If you're from overseas, you don't really have the money to go overseas. You can't travel now.
Right.
So
Travel ban.
Yeah, so it's like a lot of those kids are being homeless right now, or they're looking for places to stay, or they're rooming with other people and they have no place to put their stuff. It's like, it's crazy.
Wow, that is crazy. Jay, don't worry. Yes, we have updates on the alternative for HCG. So compounded HCG, a lot of clinics out there are not telling you guys this. So compounded HCG is going to go away. March 23rd is the last day that compounding pharmacies are supposed to be able to compound it. Now, what they're doing is they're trying to compound as much as possible before that date. Don't worry, though, because there's going to be an alternative to HCG that I've already worked out. 2, there's going to be manufactured HCG. There's 4 big pharmaceutical companies that have the biological license to produce this. And don't worry, your man John is on the scene. I'm going to be way ahead of the curve, I promise you. I've been taking HCG for over 10 years. So at that point, if we have to go manufactured, it might cost a little bit more money, But I promise you, there's going to be some sort of substitute there to help you guys out, to make sure natural production's going, semen production, and you have the aesthetics of your testicles so they don't look like shriveled baby prunes.
Yeah, you don't want raisins.
You don't want that. Some girls going to be like, what you got? You got something wrong with you? Is that the coronavirus? I'm just playing around that. But here's another thing, too, that I was reading up on yesterday, and I share with Art, and maybe you don't know. So the Chinese doctors and scientists over there, and that's where it broke out from, Wuhan, China, right? Now they're saying that males, even if they get over the coronavirus, they should be checked for fertility, because this could be affecting fertility in their testicles.
Wow.
So at that point, this is something serious. Now, obviously, they don't have any studies on this because it just broke out, but this is what they're saying they're seeing right now with their patients over there. And that's like, those are patient zeros over there, and patient zero means that's the first ones. So at that point, they're really got more information than we do. Hopefully they're sharing all this information with us, and we're getting this information. But this could affect fertility too afterwards. We don't know this for sure, but this is what they're saying. And this is what coronavirus may cause damage to men's testicles. This is very serious. And if this does, this is a population control type deal. I mean, there's a lot of things you've got to think about. Killing the old people off. This is pretty serious, guys. Because that's who it ultimately affects. Okay, John, do you have a direct email I can have some questions in regards? Yes, titanmedicalcenter@gmail.com. If you guys want to email me direct, that's my email. That was the first email I ever made, so that comes directly to me and Charisse. If you guys want to email us, if you guys need help, hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, antioxidant injectables, we can help you out. Call or text 727-389-3220.
Just stocked up too. Right before we went on here, John was online stocking up. So all the crazy stuff going on, he's already prepared. I saw him place a huge order of stuff coming in. So don't worry about running out this and that. This guy was ready to go.
I spent tens of thousands of dollars today, guys. I'm not playing on a whole bunch of supplies, antibiotics, IVs, all these medications that you guys might need, so that we don't run out, you guys don't run out, and we can securely take care of you guys. So don't worry, Titan Medical Center's on it. We're not going to let you guys down, I promise you. Rain or shine, we're going to be good to go. Man. So we talked about glutathione, TA1, vitamins, nebulizer treatments.
Yeah, nebulizer.
Okay, so if you guys don't know what a nebulizer is, there's nebulizer machines, right? And they come with a mouthpiece, and they have medicine. It's albuterol and stuff like that. Yeah. And these are made for usually kids that have like asthma or their breathing treatments to open up capillaries in the lungs. People have pneumonia, stuff like that. So this might be something you might want to look into. You could possibly get the nebulizer at CVS. We will sell the nebulizers to the machines, but the medication has to be prescribed. So if you guys need nebulizer treatments, we can help you out there too as well. So in case something happens, you have a family member, you have a kid, you have yourself that might need open, because breathing is the biggest thing. Yeah. Bronchitis, upper respiratory infections, this is what goes along with the coronavirus. So if you're prepared and at least you have it, you'll have these breathing treatments available to you in your house. Even if you get quarantined or something happens, you'll have them. If you get quarantined on a federal basis, I'm sure they have them. They have respirators there. They have all these ventilators and stuff like that. So you guys should be good. If you guys are in the privacy of your own home, you guys might want to purchase one of these and look into the medication too as well to go with it. And that's just a tip for me.
What's pros on that as opposed to someone just using a regular inhaler?
Sure. So even regular inhaler's got to be prescribed. But nebulizer treatments, I mean, you can get albuterol and an inhaler too. Right, so I guess it's the exact same. Okay. But a nebulizer treatment goes for probably about 20-30 minutes. So it really does. You really get the full gist of the medication.
Right, and it's a steady stream of humidity, right?
Yeah, so it's basically air that's pumping in there, and it's pumping.
But it's a steady stream. It's not just
steady
a pump.
stream.
You guys do the pump, it's just it's
steady
quick.
stream.
But this is like a steady stream.
Yes.
So you don't have to just
it's a steady stream of the medication,
and
you're getting like 20 minutes of it pretty much, and you're breathing, and you can like see the vapors going in your mouth and stuff. Right. And you can either get a mask.
Some of those inhalers, I heard, it can be pretty harsh. Like when you kind of, So I mean, I'm assuming a nebulizer would be a lot better because a slow, steady stream. So.
Usually, inhalers are used for like acute, like if somebody has restrictive asthma where like
right away
they can't breathe, and it has to open up immediately. That's where it is. Where people have breathing problems or pneumonia and stuff like that, they put on the nebulizer treatments to open up the lungs and the capillaries in the lungs, so you guys can take in fresh oxygen. Okay, nice. And that's another thing we're going to be looking into is oxygen treatments too as well. I've got tanks hopefully going to be ordered and delivered So if we need that, we'll have that too for you guys.
It's be a one-stop shop.
Yeah, one-stop shop. We're going to be prepared either way. You know what? It'll never go bad. So at that point, we'll be able to use it either way. So, yeah. All right. Awesome events coming up. We talked about the Big Dru Lip Party, April 4th.
It's going to be crazy.
Right? If you guys got your invites, keep those invites under wraps, okay? March 13th, which is tonight. Hopefully, the World Class Fight League is not going to be canceled. We have not. They told me that everything's going to be good. Yeah. I'll be there. Big Dru's going to be there.
Good.
We're going to be having Art. He's going to be there. We're going to be filming a lot of stuff. Sharice, a couple of the crew. We're also going to have our medical providers there. So our nurse practitioners are going to be there. Cass is going to be there. Chanel's going to be there. It's going to be good. Hopefully, it's going to be awesome. March 14th, Saturday, tomorrow. We're going to do Drop Zone Gunner out in Leesburg. It's an open environment, so hopefully we won't have no problems there. I haven't got the cancellation from that, so I think it's still on. I'll talk to Jeremy today, make sure it is. Now, April 5th, the Mad Burger Fest in Madeira Beach. I did hear that got canceled.
Canceled?
Oh. So
I was excited.
The promoter, Donna, came in. She said
I celebrated too early.
I know, right?
Yeah.
So she said, she actually came in yesterday and we talked about some of the things. And she said she's going to postpone the event, so do the event at a different time. So, we're going to have to watch out for that. If all goes according to where it should, May 16th, Tampa Bay Jeep Fest, Clearwater. We'll be out there representing June 20th, Deke Warner, NBC Florida Classic, 25th anniversary. September 12th, Iron Bay Classic Tampa. And September 10th through the 12th, St. Pete Fashion Week. We're Titan Medical Center. We'll have our fashion show on the 12th.
It's been that long. It's been that went by that quick.
Believe that?
Holy! Shout out to Rachel too.
Yeah.
I just saw Rachel on here as one of our new Titan.
Rachel
athletes.
Daniels.
Shout out to Anastasia, one of our new Titan.
Woo!
We're racking them up over
we
here.
are.
So,
we're putting together a team this year. I said 2020 was going to be the year of the Titan. Even with all the garbage that's out there, we're going to be bigger and stronger than ever. And we're going to come at you guys.
We'll get some workouts in too. Me, Rachel, Anastasia, all the Titan athletes, Big Rod. We'll get a crew togetger.
We're gonna have a serious
actually
crew.
At the lift party, you guys, all the Titan people got invited to the lift party.
Yes.
At the lift party, we're gonna get all the Titans together just for a couple quick workouts, pictures and stuff. The lift party is gonna be crazy, guys. Pictures, working out with like-minded individuals. It's basically like a workout expo.
Yes.
The vendors.
Yes.
So pretty much, if you guys have been to a large expo, everybody walks around, shows up their body. They've been working out all year. This is one where you can come and actually work out with everybody too.
Oh yeah.
So the people you see on Instagram, the people you see at the shows, the people you see on the streets, the people you see in the gyms, everyone's going to be there working out. Good vibes only event. Free Titan therapies. We're going to have some t-shirts. It's going to be insane. It's
going to be awesome. Yeah, we're a little slaying that Hercules potion pump, baby. That's what it's all about. So we are. We're going to have the Titan team there. We are truly Titan. So at that point, I'm really excited. I'm excited to get everybody together. All the new team members, all the old team members together, man, and just come together and just do what we do, man. We always have fun. Like-minded individuals. We're always going to be there to push each other up, get each other the best results we possibly can, and just come together as a family and team. So I can't wait, guys. It's going to be awesome. I think that's really about it. I mean, you got anything else?
That's pretty much it. Water. We got water going on there too.
Oh, yeah. So April 4th, Brooke Hogan and Barbie from the WWE. They're going to hold a party at Water. Titan Medical Center is a sponsor of that too as well. So we'll probably go lift for a couple hours, head over to Water, head out by the pool.
It's going to be good too, guys, because you guys are going to, if you go to my lift party, actually not, when you go to my lift party.
Yes.
After it's over, you can shoot straight to Water.
Yes.
Hang out for like an hour or two. Yes. You'll have a pump. You'll have the Hercules in you.
Yes.
So you're going to have a pump, and then you're going to go over there with that pump. Chill by the pool. The water's out there. They got food out there. There's girls, guys, whatever you want. We got it out there. Come through.
It's going to be gorgeous. Plus, I think a whole bunch of WWE wrestlers might be out there too. I don't
catch
know.
a pump at the lift party and go to Water. It's
That's
like a perfect day.
Exactly.
That's what we do anyways. We catch a pump and go to the beach. I mean, so now you might as well just catch a pump, go to the
That's right. We're going to be by the Water, showing off our good guns, our Titan athletes.
We'll be
out there. Yeah, we'll be all Hercules
out. I'll tell you that. Hercules and ECA out. Watch.
So we appreciate you guys all tuning in. Titan Lifestyle, Big Dru, every Friday, 2 p.m. No matter what, we're coming straight at you guys. This Sunday, Titan Health and Lifestyle Show, ABC, 11 a.m. Every Sunday, 11 a.m. ABC, tune in. And Titan Tuesdays with me, Titan Talk Tuesdays, 6 p.m. next week. I'll see you guys there. So I appreciate it.
That's pretty much it, guys. Be safe. Wash your hands.
Do the right thing, guys.
Just watch the news and you can see everything that's going on.
And hey, listen, if you guys want to, come join us. We'll be at the CFL tonight, the World Class Fight League.
MMA, right?
MMA, baby.
Guys. So if you guys don't know what the World Class Fight League is, MMA tonight. Tomorrow night's boxing, but we'll be there tonight for the MMA.
That's
so
right.
if you guys want to see people get down, come through. It's going to be fun. I can't wait to hear I like to hear the hits.
Yes.
I can't wait to see
I want to see some hits tonight, and
Yeah.
usually there's some pretty good hits. I remember last time we went, there was definitely some good fights. Raphael puts on an A-class, first-class event, so we're excited to be a part of it. Plus, we're giving away free Titan gear out there. We'll have some of the Titanettes out there. You can sign up for the newsletter on the iPad, get some free Titan gear, and meet us and talk to us too as well. So we will see you guys tonight, or we'll see you guys at the Lit Party or around town. Thank you guys for joining me and Big Dru. Titan Lifestyle, Fridays, 2 p.m. every Friday. Thanks a lot, guys.
Y'all better tighten up. Tightened up. Y'all better tighten up.